So, till yesterday we have finished all the topics which are related to cell and genetics. Now, the last topic which is remaining is antimicrobial agent or chemotherapy. Now, before going for chemotherapy, let us have a discussion. What are the general considerations for antimicrobial actually, and what are normal definitions are there? What are the various terms which are used when we are using this antimicrobial agent? So let us go through this before going for the topic, so that it will help us to understand in better way. Now these are, let us see one by one. So what will go for various, what is antimicrobial, what are the classifications, what are some special term, what are the mechanisms, general activities, and how the resistance are formed to antimicrobial agents, and what happens if we combine them. So it was started somewhere in 1867. Joseph Lister, who was known as a father of antisepsis, he introduced use of carbolic acid or phenolic compounds rather, and they were found to be anti-infective and they were preventing. Then next was Paul Ehrlich, who suggested using chemical compound to treat microbial diseases. Then 1928, Alexander Fleming, who observed that the mold containing Penicillium notatum, that fungus that inhibited growth of Staphylococcus aureus colonies, but he could not be able to purify the compounds, and later it was purified by the Flory and Chain. Those were two scientists who purified it, and they given it name of penicillin. So this was the first antibiotic which came into market. Then next was Gerard Domack. He understood the therapeutic value of sulfonamides against Streptococcus and other microorganisms. And penicillin, because of the extensive work, then penicillin became available in quantities sufficient for clinical use in 1941. There are very interesting stories how aeroplane flew in to get penicillin for some of the leaders who were fighting for these freedom fighters. So there are many stories you will find that how difficult was there, that the period was there, that penicillin was not made indigenously, and it was to be imported, and this import was for this penicillin one has to get it by aeroplane. So this was the story, this was the reasons, and then we have got lot of work went into, lot of studies were done, and then we have got many antibiotic, many antibacterial today. There are so many that many people in pharmacology may feel that sir kya ho gaya, itna kya hai, how many drugs, and the unfortunate case is, let me tell you, example, those who studied 10 years before me, they were having fewer drugs because that much extensively studies or many drugs were not available. They will be studying hardly few drugs. Then same drugs continued when I was studying, but new drugs were added, because the earlier drug, though they are not used in clinical practice, but they are definitely part of pharmacology. So they are always been there, they will be there, no book will remove this. And the next come is your story after maybe few years after our study or some batches. Now few more are added, but still old drugs are continue, and thus the list will go on, and you will be fortunate enough to study more drugs than the other people. So let us go for these drugs which are there. As we have seen, what are various drugs. So after that, so many drugs came in, as I told you. After that came streptomycin, chloramphenicol, tetracycline, they were discovered, and then numerous antimicrobial agents are there. As I told you, you are very fortunate that you will be having many drugs, and if you go in teaching line, then maybe after 10-15 years you will be able to very proudly say that they will be more fortunate than you that they are having still more drugs to study, because older drug will not be removed. So let us classify how we classify them. That we can classify them by multiple ways. We'll classify them in variety of ways, that is on the basis of their action, whether they are acting on bacteria, whether they are acting on viruses, they are acting on fungi, they are acting on protozoas, they are acting on metazoas. So on that basis we have got these drugs, and we call them accordingly antiviral, antifungal, antimetazoal, antiprotozoal. Although there are antibacterial, but we classify antitubercular drugs specifically differently, because although tuberculosis bacteria, that is Mycobacterium tuberculosis, they are bacteria, but they behave very differently than other bacteria or routine bacteria, and therefore we have got so many classifications, so many ways by which we can do. So this is one classification of antimicrobial agent, that is on the basis of their action or type of organism. Now let us understand what can be the relationship between various things are involved in that. So host is the patient, because he has got infection, and there are pathogens which are there, and third one is a drug. And these are actually three things which will be very, very important for the selection of antimicrobial agent. One is, first one will start with the infectious pathogen. As we have seen, it can be bacteria, it can be virus, it can be fungi, it can be metazoa, it can be protozoa, it can be anything. So accordingly, these are the pathogens. Then these pathogens are entering to the host, and they are causing infections. When they are causing infections, then host needs, or they will cause infection. There are circumstances that there are chances or increased probability of causing infections. So then these are the second thing. First one and third one is a drug. These are three elements which are there, that are host, infectious agent, that is pathogen, and drug. So first thing is, what kind of situations are there, and then next will be the drug. So these are three relations are there, and when everything is okay, when everything is suiting each other, then only it can be used. Example, as I told you, infectious pathogen will try to make infection, and there will be host defense mechanism which will try to prevent it. When the pathogenicity will be more, which will overcome this host defense, then there will be an infection. Now at the same time, there are drugs. This drug will have their antimicrobial effects. You people have got very bad habit actually. You are entering almost 25 minutes late. Why you are actually coming? I don't know, understand. After 20 minutes, 24 minutes, 25 minutes, you are trying to enter. Just now Mohini Patil entered, Sushil Landge just now entered. And despite all these everyone I am trying to accommodate, hardly there are 13, 14 students, they are coming. This is not a good sign from your side. So next is, the antimicrobial agents are there. So these are the drugs which are capable to affect these infectious pathogens by various ways. And there are also simultaneously there are chances that infectious pathogen will have, we call it as a resistance, that not to get killed, not to get affected by these drugs, we call it as a resistance. Further, we have seen general pharmacology, these agents will have some effect on the host, that is, and on that basis either they will be effective or they will be toxic. There will be some pharmacokinetic situations, and because of that, until and unless all these are favorable, these drugs are not useful. So there are many such examples we can have, that is related to pathogens, related to drug, or related to pathogen drug. As I told you, there are many drugs are known that they have found resistance or they have lost their effectiveness. Then in host, we have found that if we consider it drug versus host, then there are many host, example age wise, there are certain ages, example chlorophenicol cannot be given in the younger ages, it causes more toxicity. So there are many such that depending on the type of host, some cannot be given in pregnancy, some cannot be given in certain other disease conditions. So when we shall see various drug, at that time we can have this list. But these three factors, they will deciding the selection of antimicrobial agents in particular. So what was the infectious pathogenes, then what's your drug we are selecting, accordingly we should see that it has got more antimicrobial effect. And third one is what is the relation between host and drug. So these three things will be very, very important, and on that basis we can go for selection of the drug. Then antimicrobial therapy, why we are going for, it was, as we have seen that these various scientists they gave theories, they proposed that because earlier it was not known, people were dying and it was not clear that why people are dying. And then they proposed theories, example it started with Louis Pasteur and Edward Jenner and other scientists, that they found that or they proved that actually the people are dying, the death is because of okay. Just a minute, I'll put it, because of loss in connectivity, presentation went off. So I'll repeat, these are the situations, that is the host, patient and infectious pathogen, they are very, very important. So pathogen, host and drug, until and unless these three are having or the drug can match, then only the drug will be effective, so that it can have a good antimicrobial effect and it can destroy it. So in that case only it will be more useful, where the minimum toxicity is there, more acceptable to host, in that condition it will be used. Then we were discussing about antimicrobial therapy. As I told you that initially when this scientists like Jenner, scientists like this just now I told you, Robert Koch and all these scientists who gave that theory about involvement of microorganism, then it was realized that yes, when many people were dying otherwise, and it was not known what was the reason, therefore many customs were there. Maybe you might have seen that if some death is there, then they give wash to the dead body, or then whenever go for crematorium, then people ask that they should bath or they should be taking care. These were all various measures were known that it is it can decrease or it can make it, or otherwise people were thinking that it may be the some soul of the dead person, and because of some scene of the people he is taking, or he is causing the death of another people. So there were many such things, particularly where epidemics, pandemics of various infectious diseases were happening. And then these scientists, they understood, they put it a theory that yes, these are various microorganisms, they are and it actually their birth started with, you might have studied it in microorganism or microbiology, that Anthony Leeuwenhoek, he first invented the microscope, and because of microscope they could see that there are something which cannot be otherwise seen in naked eye. They gave the name microorganism, and then these scientists started working one after another, and then they proven even relationship between various microorganism and type of infection, just like we say that tuberculosis is caused by Mycobacterium tuberculosis. So these were the sequence. Now when it came again, then scientists work on that, that whatsoever antimicrobial therapy, when it was found, when it was realized that there are some antimicrobial agents, they can be used. As we have seen that Domac has used sulfonamide, before that Fleming has found it, before that even other scientists, we have made this list of various scientists, or Lister has found that if we can make the things antiseptic, then we can have surgery. So these are where there won't be any infection, and the people will, or the person will get cured. So these are various observations people have made, and on that basis of this observation, these are very good. If those who are interested, I'll suggest you to read their stories, that how it was there. That we call it as a serendipity. It was by chance they applied, they found that it is there. I think it is given in Katzung, various stories are given, or you can read the stories also, you can search it on internet also, that how the scientists they found this antimicrobial agent. Very interesting studies are there. That example is Domac found that some dye was there for some other purpose, and it has prevented microorganism growth. This penicillin inventor, that is, he found that in the fungus, he put bread for his eating, he forgot, he was so busy, and he forgot, then there was a fungus, and he found that somehow the part of that fungus, that because of a mistake of assistant, normally if you have seen these plates, okay, Petri plates are there. In Petri plates they are covered and they do not allow any contamination, but somehow that fungi cause contamination, and because of that contamination of fungi, there were some zones of inhibition. You might have studied this zone of exhibition, zone of inhibition, or bioassay using microorganism. This is all microbiology you might have studied. So they were found that, and then it was found that this penicillin is causing something to the staphylococcus. Therefore, in the area the staphylococcus is not growing. And then other Florian chain, these were the scientists who could separate it, who could extract it, and who could make it. Now then the scientists went into various studies, and then scientists found that why this is happening. Then they found that the bacterial infections, they provide difference in the physiology, and that can be targeted for the therapy. If you remember, recently we have studied all the genetics or the cell biology, and there we have find many things. Example, in cell biology, if we say that cell membranes, so human cell membrane and the bacterial cell membrane, they have many differences. Okay, in most of the bacteria, they have got their own cell membrane, which is a different, we call it as a presence of peptidoglycans and other structures which are not present in human being. So similar many structural differences are present in viruses and other things. So these are cell wall are different. These are the anatomical or physiological difference in the microbacterial cell and human cells. Protein synthesis, ribosomes are different. We have seen 70S, 80S, or the subunit are different. Metabolisms are different. Bacteria bacteria cannot have their folic acid synthesized, and therefore if we prevent it, then human beings, they have folic acid, they are rich into it. Then DNA synthesis, topoisomerase are the enzymes which are there, or we call them DNA gyrages. Then RNA synthesis processes somewhat different, membranes are different. So these are various places where there are differences between microorganisms and human beings, and scientists could try it, scientists could target it successfully without affecting. So initially whatsoever antimicrobial agents were there, they were comparatively having more toxic effects or more adverse effects, and slowly when it was realized what are the situation, why one are better, why others are not better, or why there are toxicity, and slowly then we could get better and better antibacterial agent with more selectivity, more better actions. So these, let us have various definition. First is antibacterial agent. So it can be defined as substance from microorganism or synthesized that produce either bacteriostatic or will define this bacteriostatic, bactericidal also. So these are agents which are affecting microorganism by any means, and they can be from any place. They can be either from natural one, they are available from bacteria, fungi, or by any other way, or they are synthesized or they are synthetic in nature. They all are antibacterial agent. But antibiotics are the substances which are actually excreted or or released by some other microorganism. Example, most of the fungi, they are releasing this, and they are producing the action which can be either bacteriostatic or bactericidal. And these are the various we can have this, we can define it in that. Then antibacterial spectrum is very important term. We call it them as a antimicrobial spectrum of drug. That means how many different species of microorganism the drug can affect, either inhibiting or kill. And narrow spectrum means these agents are having action against only single or limited group of microorganism. Example, isoniazid is active only against mycobacteria. It is not antimicrobial agent for, maybe if somebody says ki, this isoniazid, it is so good for the very difficult treatment like mycobacteria, can we use it for staphylococcus or streptococcus? Then it is not useful. So this is what we call it as a narrow spectrum. Broad spectrum are there, that these are the agents, they are affecting a wide variety of microbial species, and they are referred as a broad spectrum antibiotics. Example, tetracycline, chloramphenicol, they are broad spectrum. And usually broad spectrum antibiotics which are, when we are using, then we have got one difficulty, one problem we have got. If you remember, if you are known about it, we call it as a presence of microbial flora in colon or in large intestine. There are many microorganisms are present, and these microorganisms are symbiotic, means they are also growing and they are helping us. They are doing many work for us. They are, if you remember, vitamin K, just recently we have studied in blood coagulation, that vitamin K production is done by this microorganism. There are many such activities they are doing. And there are bacteria like lactobacillus, some E. coli, some other bacteria. These are called as a bacterial flora. And when we are using this broad spectrum antibiotic, now otherwise it looks very good. If somebody says which you will take, narrow spectrum, broad spectrum, definitely one will select broad spectrum. Why? Because broad spectrum has a ability to kill many microorganisms, isn't it? Something like that. You have got simple small gun, and these are like machine gun, so it can able to kill so many things simultaneously. But the problem is, if they interfere or they affect the normal bacterial flora which is in our colon, then it can precipitate in a state that is called as a super infection. Okay, and it can disturb flora, because normally they are preventing the infection also. The normal flora is there, it is not allowing other bacteria which are, we call them as opportunistic bacteria. Otherwise they are not pathogenic, but when situation, you might have studied all this term in microbiology. What are the opportunistics, what are pathogenic, what are virulent, etc. There are many such terms are there. I will suggest you please read it. So in that cases, these bacteria are there and they will cause super infection. Then what are bacteriostatic, what are bactericidal? Bacteriostatic drugs, they are agents which arrest the growth of or replication of the microorganism, but they do not kill them. Okay, they causes what? They will not allow the microorganism to duplicate. Normally, if you remember, the multiplication time of bacteria is 20 minutes. So in every 20 minutes they will be doubling. You can see the exponential curve then. So every 20 minutes, 1 to after every 20 minutes, from 1 to 2, 2 to 4, 4 to 8, 8 to 16, 16 to 32, 32 to 64. So these are every 20 minutes this is happening. You can imagine that how rapidly they are growing. And then this is the problem where host defense mechanism cannot control it. Up to certain level, up to certain amount of microorganism, host defense mechanism can control it. But when it goes beyond it, then it becomes helpless, and then these microorganisms show their effect by various ways. So bacteriostatic drugs, they will arrest the growth, they will not allow this replication. So every 20 minutes will be there. That will be when the drug is available, it will be stopped into that, it will be blocked, it will kept like that. And as per life cycle of the bacteria, that bacteria will die itself at its own without get killed by these agents. However, the bactericidal drugs, they will able to kill the microorganism, and therefore we call them as a bactericidal drugs. Okay, so they can also destroy them, or they will able to kill it. And any drug can be bacteriostatic for one organism, and it can be bactericidal for other. This can happen. Okay, these are there are many such drugs which we can see when we'll see individual drug. But this can happen that the drug is bactericidal for one organism, it can be bacteriostatic for other. Now let us see how the drugs are acting. See, this is the log number of viable bacteria. Viable means live or which are able to duplicate. So if there is a no drug is given, there were some bacteria were there in the initially at the time T0. Some bacteria were there. With time, we know every 20 minutes they are multiplying. Therefore, we have taken it as a log. Log means 10 raised to 1, 10 raised to 2, 10 raised to 3. So from 10, 10 to 100, 100 to 1000, 1000 to 10, 10,000, 10,000 to 1, like that. So every time one zero will be added, and accordingly this is a growth. So this is very rapid growth. Now suppose we add drug at this point. So if our drug is bacteriostatic agent, then it will keep it like that. The drug, it will not allow to grow faster like this. Okay. And if these are the bactericidal drugs, then they will kill it and they will reduce it. It will bring it back to the zero or near zero. These are the bactericidal. Here bacteriostatic also, actually it will go slowly towards zero because of the natural death and then human host mechanism. That may cause when host mechanism is able to counteract this amount of bacteria. Suppose it reaches to this level here, which goes beyond the host defense, then in that cases host will not able to control. But suppose up to certain level host can control it, then bacteriostatic agent will just help these cells to help into it. Then there are few terms which are important. One is known as a chemotherapy index. It is a term which is used to evaluate the safety of chemotherapeutic drugs, and the value just like our therapeutic index, like LD50 by ED50 or LD5 by ED95. These are various values which are given. We can have like that, just like therapeutic index. You might have studied it in your pharmacology, general pharmacology. So these are the index are there. This is very, very important. Again, you might have studied this in microbiology. That is called as a, what is a minimal inhibitory concentration. So it is the lowest concentration of antimicrobial agent that prevents visible growth in 18 to 24 hours of incubation. So this is called as a MIC. Usually it is in nanopico or micrograms. You might have done the experiment of what we can say to determine the MIC of various microorganisms. You put various antimicrobial agent, you see the zone of inhibitions during that. So this is how various calculations are there, and on that basis MICs are calculated. So very, very important strength, very, very important ability of these agents is MICs. So any antimicrobial agent has to be recognized or has to be confirmed with their MICs, and their MICs should be small enough that at that particular concentration it is not affecting the host or it is not affecting the human beings. So that much MIC should be there. Otherwise there can be many drugs. But if the drug kills human first and microorganism later, or almost same dose or just slightly lower dose, then they have no use. So only MIC that is useful, which can cause, which can be having long or big difference between toxic concentration, or that is we say chemotherapeutic index wise, to the human being, and having very stronger or at lower, very lower MIC, it is affecting the microorganism, causative microorganism. So minimum bactericidal concentration, that is the minimum concentration that is need to kill about 99.9% of the testing animal. And if the